everyone. I'm Allison Rand, Vice President of Inspire. It's a pleasure to welcome you to our webinar today, Putting the Pieces Together After Ostomy Surgery, Identifying Your Inner Pieces, which is co-sponsored by Ostomy Secrets and the Inspire Ostomy Great Comeback Support Group. I am so excited to introduce you to our fabulous, inspirational speakers, Lisa Becker and Cricket Henley. But first, I want to share a little about Inspire. We are an online social network of patients and caregivers. We are over 500,000 members strong and growing daily. We have 200 online communities, including our Ostomy Great Comeback Support Group, where people come together and share ideas and support one another. If you aren't already a member, visit inspire.com after the webinar and sign up. Now to get started. For those of you who attended our first webinar, welcome back. I'm pleased now to introduce our two speakers from Ostomy Secrets, Lisa Becker and Cricket Henley. Lisa Becker lived for many years with Crohn's disease, but has turned her years of adversity into a career passion with Ostomy Secrets, a fashionable business that caters to helping fellow ostomates feel more confident in everyday life. Lisa's co-presenter is Cricket Henley of Ostomy Secrets. Cricket Henley was diagnosed with Crohn's disease and ulcerative colitis over 25 years ago. She underwent permanent ileostomy surgery and, like Lisa, now speaks and writes on the topic of living well with an ostomy. I find both of them incredibly inspirational, and I'm sure you will too. To get us started, I'll turn it over to Cricket Henley. Thank you.
Well, thank you, Allison. We are super excited to be back today to share with everyone the inner pieces of our ostomy puzzles. Just to bring everybody up to speed in case they missed the last webinar, which, by the way, in our follow-up email, we will share with you a link so that you can hear it. We introduced this concept of building a puzzle to help you walk through your ostomy journey. In the first webinar, we discussed building your border pieces, which included navigating the basics from the right pouching system to leaving your home. And like I said, you can check the link out if you missed it. So today, we're going to build our inner pieces, which our hope and our desire for you today is that this will give you more practical tips along with emotional insight on how to make your puzzle this beautiful picture that it's intended to be. As Allison mentioned, both Lisa and I have permanent ostomies resulting from Crohn's disease. Lisa had her surgery in 2006, while I had mine in 1994. Well, I'm really excited because also joining us on the phone today is a dear friend of mine who I believe I've known him for nearly 20 years. Alan Farr underwent urostomy surgery as a result of an invasive bladder cancer. Had Alan not had surgery, there was the potentiality for the cancer to spread into his other healthy tissue. So last April 2013, Alan had his urostomy surgery, and later today on this call, we're excited because he's going to chime in with some of his thoughts and his experiences. So let's go ahead. We're going to get started with today's presentation. Lisa, I'm going to throw the ball to you as we build our inner pieces of the ostomy puzzle.
Great. Thanks, Cricket. Good afternoon, everyone. I hope you enjoyed today's webinar. So thinking about these inner pieces that we're going to discuss today, I think the best way to describe what we're going to talk about is that life is moving through stages. We all know that. No matter if you have ostomy surgery, what have you, whatever experience you have, you move through stages of life. And the best analogy I could think of with regard to ostomy surgery is that those of you who are married, before you get married, you have a courting stage, the dating period, and then you have usually an engagement period, and then you have the wedding and then the marriage. And I've been married 10 years, and so, my life with my husband is a little different than it first was when we were dating. There were certain things maybe I was embarrassed to talk about, and over our courtship onto marriage, we developed in stages of becoming closer, more communicative, etc., more comfortable with each other. And so that's how I view kind of describing these stages of ostomy surgery. After you have your surgery, you always have that fear in the beginning, the unknown, and over time you gather more information not only about yourself but about how to actually manage your ostomy appliance. So our job today is to fill in those pieces for you, those inner pieces, fill in, maybe accelerate your journey process that you're in right now. Our job at Ostomy Secrets, it's always been the why I started the company was that the mission was always to help others. And that's not just through products, that's through things like today. So the culture has always been and always will be reaching out to others and helping others. Cricket and I feel that we've had, over the past 5-6 years, an accelerated journey in learning about, talking to our customers every day. We travel all over the country, sometimes out of the country, to speak to others about this. And so we've learned from our customers, and we feel very blessed. So today is about passing all that amazing knowledge that we've been so blessed to achieve really early and quite accelerated. And we want to accelerate your learning and provide you with the tools and tips and advice today for continuing living with a better life after ostomy surgery. So to overview exactly what we're going to talk about today, what are those inner pieces? So communication, obviously communication is the key to life, right? It's a key to really anything that you tackle. So we're going to address that first. Getting back to life, intimacy, everybody has questions about that. Exercise and swimming, and traveling. Again, over the past 6 years, talking to others in person and on the phone, we've prepared and compiled a list of the most asked questions, and they were all in these categories. So it's really about helping others manage their ostomy after surgery and creating a better lifestyle. So with that, I'm going to pass it on to Cricket, because I think creating a better lifestyle starts with number one. And I love this quote. Cricket, you go ahead.
I do too, Lisa. I love, one thing that's been amazing on this journey has been the wonderful wound and ostomy nurses that we have met. Whenever you see WOCN, that stands for Wound, Ostomy, and Continence Nurse. And Rhonda is one of the nurses that we've met along the way who had this quote, and we put in one of our newsletters, and I love it because I think you all would agree, if your attitude is negative, if your attitude is down or depressed, then that is kind of how you're going to feel. So you really, with having an ostomy, you really do have to set the right state of mind. So I love what she said, that life does not stop when you have an ostomy. Yeah, things are different, there's no question, but you are the same person, and you can still do nearly everything you did before. And this has kind of been our mantra: make a choice to live a lively life. I could choose every day to say, I'm never leaving my house, I'm not going to be intimate with my husband, I'm never going to travel, I can't get back to work because of my ostomy. Or I can say, you know what, I can do everything I did before, it's just different now. So as we move forward in the presentation, Lisa, we said the first inner piece that had to be placed inside this puzzle was communication. And we really, as we kind of tried to unpack this, we felt this core piece, P-I-E-C-E, really brought peace. P-E-A-C-E. And so with that, I love how you talk about this, because that piece brings peace. So tell us your thoughts on that.
Thanks, Cricket. Well, as we all know, we all communicate differently via language, body language. You have introverts, you have extroverts. Everybody is so different in how they truly, let others know how they're feeling or not feeling. And for those of you who know me well and know my personality, an example of this was, I could pretty much talk to the wall, and I still can. I'll talk to anybody who's willing to listen. But after my surgery, I really became quite introverted, because mentally and physically, I felt like I needed to get a hold of what I wanted to do. How did I want to talk to others about this surgery? I just became more subdued about some things, just to think about how I was going to present certain things. So along the heels of that, I suggest the biggest thing after surgery is decide where you want to be with regarding telling others about the surgery. So, for example, how do you want to present this surgery? Everyone's going to know, usually, you've had the surgery because you've been sick, and usually that means that there's been maybe some time away from work or some time in the hospital. So people are going to ask, how are you feeling? What happened? And that's going to be because they care. So you want to be able to articulate your feelings and not convey too much, maybe not convey enough so that you kind of satisfy how they're concerned for you. So decide, what are you going to tell your immediate family, for example, your spouse, your kids. Then what are you going to tell your friends, maybe the outside circle? And then further than that, how are you going to prepare for work? So I like to view this really as the core of this presentation, because think about throwing a rock in the water and how those circles form around that rock in concentric circles. And so that rock is communication. And so I feel that if we really hone down on how we're going to communicate the situation to others, it will relieve some anxiety and stress, unwanted anxiety and stress, obviously. It will eventually lead to emotional healing as we become less worried about what we're going to say, how we're going to say it. And also, you have to just be, what you decide in the beginning may change. In the beginning, I told everyone I wasn't, my husband and I said what I had was not permanent, and it wasn't a permanent ostomy. And look what I do today, folks. I mean, I scream basically from the mountaintops that I have an ostomy, and I'm proud of it in order to pass and help others and pass information on to others. So quite two different stories, but it's how it was my personal journey. So I think that's really important to present. Also, be aware that how you present it to others when you're ready is how they're going to view it. So if you state things very matter of fact, and if you are not dominated by fear, then that positivity is going to reflect on that person, and therefore they will not view your surgery as this horrible thing that's happened to you, even if you think that it has. So on to the next slide. After thinking about that communication, I think it goes hand in hand with submerging yourself back to work. And to make this a little less stressful, in the first webinar we talked about some basic tips on how to deal with your appliance, making sure you know how to put it on, dealing with we had some tips for odor control, diet suggestions. So make sure those are honed in when you go back to work, because when you go back to work, when you go to a public restroom, that may be a source of stress for you, worried about going to the bathroom for fear of odor. So, figure all that out beforehand. Also figure out how exactly you're going to express to work the situation that you're now in. For those of you maybe who work on an assembly line and you have a certain amount of breaks at certain times, maybe you're going to have to change that up and maybe have more flexibility or tell your boss a little more because of that, versus someone maybe that's in an office setting that has a little bit more flexibility. They get up and go to the lavatory whenever they need. So there's something that everybody is, it's a very personal, individual situation, and you have to decide what is best for you. At the end, we're all about being prepared, and we're going to mention a lot of things today, because if you're prepared, you can manage a situation and it will not manage you. And therefore, that will really transcend you to being more comfortable with this lifestyle and being more positive with it. For me specifically, I happened to be a stay-at-home mom at the time when I started Ostomy Secrets from my house, and so there were some issues there, but for the most part, I was really quite blessed with having the flexibility of staying at home. Cricket, I know that you were in a similar situation with being a stay-at-home mom as well.
Absolutely, and even no matter where you're at, and I love what you said that, like if you're in an office, you're at an assembly line, you're at a store, wherever you are at home, the preparation and the management is so, so important. And so instead of, like today for this call, I made sure that I emptied my pouch before I got on, an hour situation, because I didn't want to be like, oh, golly, in the middle of the conversation, right? So preparation, don't let it manage you. You are managing it. You are in control of your ostomy, and I think that's so important. I want Alan to pop in on this part, because, Alan, I know for you, you just had your surgery just over a year ago, a year and a month or so, and you got back to work pretty quickly. So why don't you share with our listeners, what did you do and where you work and how you were able to manage that so you managed the ostomy and it did not manage you?
You betcha. Thanks for inviting me to be on this call. I really appreciate it. Glad to be here today. Yeah, I think like Lisa and Cricket have been saying, knowledge and preparation is absolutely key. I came back to work 7 weeks after my ostomy surgery. Felt a little early for me, but I was auto prepared. The knowledge came from, really started with the ostomy and wound care nurse, and from there, kind of much like the ripples in the water, I talked to different people. We have an ostomy support group in the community that I am in, and I just asked people, me, how did you deal with this? And so I started learning about things like have your kit nearby, take a change of clothes to work. And so I did all those things, and I put the clothes in a drawer, and they're basically the same place where I put them a little less than a year ago. I too pay attention to emptying my pouch. I have a urostomy, so it's urine. But I pay attention to emptying my pouch before I go into meetings. I did the same thing that Cricket did before getting on this meeting, so I wouldn't have to pop up. So I just, it takes a little bit more awareness. Oftentimes I will check my seal as well before I go into meeting, much less so now. I got much more comfortable with realizing that this thing is not going to fall off. Quite the contrary, it stays on quite good. So sometimes I forget about it, but I know that I've got my kit and my clothes there if I need them.
That's awesome. Thanks, Alan. And that is so great because, once again, you're managing it and it's not managing you. So if you hear nothing else we're saying, I hope that resonates with you, that you are in charge of it. So moving forward, intimacy and relationships. Lisa, we always joke about it being the elephant in the room, right? And everybody wants to talk about it but isn't really quite sure how to. And, I always tell people when I'm out on the road speaking, I say, you were created for intimacy. You were created for relationship. Do not allow your ostomy to rob you of that. Sure, it might be a little bit different than it was before. It might feel like, oh, golly, what do I do with this? But communication, once again, like we were talking about that peace, bringing you peace, communication with your partner. Before you had your ostomy, I bet you had to communicate because women have cycles, men have issues. If you have small children, if you have people living in your house, whatever the situation is, you need to communicate with your partner. It's no different now. That communication has to continue. And how do you, as a person now with an ostomy, make yourself feel that you can be in this situation? Lisa, I like the two to tango thing because it does take two to tango. And, develop that a little bit more for us of thinking about each side of the equation.
Absolutely. Obviously, I would hope that it takes two to tango. But one of the biggest things before getting down to the specifics, which I'm going to just clarify here, that intimacy does not necessarily mean actual sexual intercourse. Yes, I did say that word. Intimacy is far greater and emotional than we all, give it credit. So I want to start off by saying that. The other thing that I learned very early was that, and luckily I learned this early, when we are the patient and we are sick, it becomes very me oriented because it has to be. We have to get better. And we're so worried about managing the appliance. And so the focus is on us. But I think what we really need to remember is we really need to think about our spouse, our partner, and their feelings in the situation. If we have, I mentioned earlier about how we view it and how we present it, and others will kind of adapt how we have presented it to them. Same thing happens with this. If we have a good view of our body image and how we are, it will transcend on the other side. So, for example, how I presented it to my daughter when she was just 2 and learning how to potty train, I didn't hide it from her when she would barge on me in the bathroom, and typically that happens a lot these days with my kids. Because if I act embarrassed and if I hid it, then she would then think this was a bad thing. And I didn't want her to think it was a bad thing because it saved my life. I wasn't necessarily that comfortable with it at the time, but I was getting there. So same thing happens with intimacy. The other story I'd like to share is that a few years after my ostomy surgery, something came out with my husband and I that I thought was really touching. And, he had always turned away whenever I changed my ostomy appliance, and I just don't know if that was out of respect or maybe closetly I think I always thought he thought it was gross. And then one day when I kind of called him on it, so to speak, and told him, I know that you think it's gross, he looked at me and said, it is not gross. I don't look at it that way. It's not, he's like, that doesn't bother me. We lived a long time with you with Crohn's disease, and I dealt with a lot of other things. He said, but viewing that ostomy pouch represents a very painful time of when you and I went through the hospital together and you were so sick. So it's not the actual ostomy pouch that was gross to him. It was the idea, what it represented. And I think going forward, I think that we just need to remember that. We need to think of our partner's feelings and think about what they have gone through with us. Or maybe even if they were after the fact, maybe they have some stigma attached to it. Maybe they had a family member that was sick with something that they're now attaching it with you. So it's far deeper than just us, basically. So the next slide, Cricket's going to go into, she has developed this phenomenal method of, thinking in your head and going for it. So the 3 Ps, Cricket, this is all you.
Oh, thanks. Well, I've been a teacher for a long time, and I'm still teaching in some degree. I'm homeschooling my 9th grader, and I like to put things in a simple way for people to remember things. And so we came up with this years ago in the March, I think we ran it in March 2011. I think we ran it before that too. But one thing I wanted to do was say, help people have a plan. Help them to know what to do. So the 3 Ps to success, always remember your plan. What is your plan? So this seems like a kind of Captain Obvious statement, but if you have a urostomy and you think that later in the day or the evening or whatever you might have a chance for intimacy, don't drink 64 ounces of liquid. Or if you have a stool ostomy, don't eat a head of broccoli or something else that might make your stoma act up and act like the Goodyear blimp. So be thinking about those things. Once again, going back to that communication, if you know that there's an opportunity, be prepared and plan and know your timing, and then the preparation that comes with it. Our mission at Ostomy Secrets has always been, from the beginning, to give you this opportunity to get back to your lifestyle. And, I think back with what Rhonda said about making the choice to live a lively life. Well, this is where this comes in. We've created products that help both men and women to have this confidence, because we want you to be out of sight, out of mind, so that you can be focused on the business at hand. And so when you prepare by wearing something that covers your ostomy pouch and you feel like it's nice and it's tucked in, you are going to be able to present yourself to your partner and feel confident that you can focus on them and they on you, and it can be a beautiful experience. And then once you've done that, proceed. Go for it, Empty your pouch. Wear a smaller one. Figure out what you feel most comfortable with in a pouching situation for intimacy, and then go for it. This ostomy thing, it's a reality. And the situation is, like I keep saying, you have to manage it. But once you know you're ready, you know that you can go forward and you can proceed with it. So just think about the 3 Ps to success. I think those are real simple, and I think they're good. Lisa, it's funny. We have evolved a lot since October 2006 when you started this company, and the pictures here I think kind of show that. Share quickly how we have evolved these products, really based on your need.
Absolutely. And I just want to start off by saying, for those of you who have found a solution, I am so glad. And those of you who haven't, maybe this will be a solution for you. But I think what's important is that when we started Ostomy Secret, the first picture to the left, that was called a Vixen Wrap. That was our very first product that addressed my personal needs for intimacy. And yes, my husband played probably 50% of a role in helping develop it, because I wanted him to think it was attractive and simple and not too much. And so notice it's a longer band. The length is longer. The pocket extends fully so you could have a full ostomy pouch without folding it up. And there's ruching panel on it, covers the bump. You are completely taken care of with this. And then over time, as I became more comfortable, which took about a few years for me. Remember, mine was a little accelerated given what I do every day. I wanted to feel a little more like I did before surgery, right? I didn't have to wear anything special before surgery. So now that I do, I wanted to feel less material. And so that's where the Illusion line came from. And the Illusion Wrap is actually much more narrower. It's not as long. The pocket is half the size. And the reason was that, I didn't have to extend my ostomy pouch fully for intimacy. I just could fold it in half because I wasn't going to be eating during it. At least I personally wasn't. But I was able to fold my pouch in half, and Ironically, the illusion created, given it was the pocket was the color of my skin, and then the fabric to the left I didn't need a pocket, so it created a seamless effect across my abdominal wall, and really that did a huge just boost in my overall body image, because I'll never forget, my husband saw me for the first time. He's like, wow, it's like it disappeared. And it did in my head, and it was less material, and it just felt great, and I felt great in it. So that's indicative of the stages that we all kind of go through. And, you know, there are people on the phone that the Illusion Wrap might never be for you. Maybe you're a Vixen type, or maybe Vixen's too much for you, and you want to go right into Illusion. Whatever works for you. But it's important that you understand kind of where the products originated and how they came about based on my own personal need. I wear it every day. Well, not every day, but I wear these products, and I pick the fabrics accordingly, because I personally use them. And then we also have on the further right is the Classic Wrap. That's a unisex product. Men and women wear these products for all needs. Usually for intimacy, the males, obviously the men don't prefer the frilliness, so they like the look of the Classic Wrap. And the best person to contribute some insight to this is Alan. Alan, what is your plan for intimacy?
Yes, thank you. It's definitely that Classic Wrap there. I have two. I have a white one and I have a black one. I think they may be just a little bit narrower than the one that's shown here. I have not been in a relationship or intimate since my surgery, so that is a yet for me. And but I feel very confident. Again, I've talked to people, but I have this wrap in my back pocket, and I know what I'll do when I get to that point. And like you were talking about earlier, it's going to be a lot about the communications with my partner as well. But as far as the actual mechanics of the physical intimacy, I don't see where it's going to be a problem at all. Like you said, probably a little smaller pouch. Don't drink, a liter of water that day or beforehand. And I don't know. I have a lot of confidence that I'll be able to do that with this wrap. And I use this wrap for other things too, which I'll talk about later. But this is a big piece of my plan.
Oh, great, Ellen. Thank you so much. I really appreciate that insight, and I'm really happy that it's worked out so well for you. I think it's all about confidence, so that's great. So moving forward on the next slide, getting active. I would think that, certain intimate activities usually involve some movement. We're going to address the movement aspect. It is all about attitude and pairing, like we've mentioned, and management. And so I'd like to just mention that before my surgery, having Crohn's for over 20 years, exercising moved my bowels. And so that was a very miserable thing for me to partake in, and it was very stressful. Sometimes I wasn't even exercising. I was just walking somewhere. And I'll never forget those hot flashes and that intense pain and the fear of not being able to get to a bathroom. I will never forget that. So I am grateful for my ostomy surgery. So I really want to participate in celebrating this newfound freedom that I've never had before I had my ostomy. After ostomy surgery, I could go for walks now and not be stressed out, and I could do active things. So that is something for those of you who have had bowel surgery, usually you've gotten to this point maybe due to similar experiences that I have. And so it's important for us to remember where we were before and kind of, some of the negative things that we tend to forget, remembering them and celebrating some of the newfound freedom. So with exercise, clearly swimming is a hot topic. Very hot topic on the Ostomy Secrets line in the beginning stages. I was very worried when people said they didn't know you could bathe or shower. I had talked to people who were several weeks post-op, and so I said, get off the phone, go take a shower and get wet. Same thing with swimming. They thought they would never be able to swim again. And that is just not the case. This ostomy appliance is supposed to get wet. They're made to get wet. They're made to withstand a lot more than you think. And Cricket, in my beginning stages, which I met Cricket soon after my surgery, I was so lucky about that. Mwah, love you, Cricket. She gave me the best tip regarding getting wet and just being confident. My issue, I just wanted to feel confident in the pool. And so she had a bathtub tip, and I'll leave that. I'll hand that over to you, Cricket.
Yeah, it sounds so simple, but once again, some of these things are like, oh gosh, I'll try that. And so get in the bathtub first. Give it a try there. See how does your ostomy appliance perform with a lot of repeated exposure. A shower's, 5, 10, 15 minutes, but when you're in the pool or you're swimming laps or whatever, the bathtub trick kind of helps you see, am I having a good seal? If you feel like you need a better seal than what your wafer supplies, there are so many great products out there, berry strips from all different kinds of companies that you can kind of picture frame your wafer with. There's the pink high tape. I know, Ellen, you like that. There's the micropore tape. There's so many things. And so if you know you are going to be repeated water exposure, try some of those things and get a good seal and have fun. Get in water and just do what you do. And, a big part of this is securing a swim bottom. And if you don't secure a good swim bottom, you might do what I did the first time I went swimming. So in the
I love this.
Lisa loves this story because she knows me very well. And I, always wanted to be a circus performer, but I could never do that until I had an ostomy. So I got invited to go swimming very quickly after my surgery. And guys, I was so afraid to go to a public pool. I was so afraid that everyone would know I had a stoma. And so instead of wearing a bathing suit, I decided that if I wore a full one-piece unitard that no one would know. Well, picture this with me. A grown woman getting into the pool with a one-piece unitard like this in the picture. I think I drew more attention to myself than I would have had I just been wearing a bathing suit. So it was just crazy, but I was so afraid, and I wanted to do what I wanted to do because I was used to those things. So when I met Lisa and we started talking about different products for swim, because like she said, everybody's like, can I swim? What do I do? What do I wear? There was once again kind of like the intimacy wraps. There was an evolution of products. And you can see different pictures here where each of these people is wearing a little bit something different. Lisa, I'm going to give you the platform here to talk about the solutions that we talked about. How can we get back in bathing suit in the water?
Absolutely. Well, this story kind of how these products were created might better explain how which product is best for you or not. So in the beginning, the issue for me was pre-surgery bathing suits. I like to wear two-piece bathing suits because it's easier for me to empty my pouch. So I noticed all my pre-surgery bathing suits didn't come high enough, and I think that's a common complaint. So we created the swim wrap. So it's bathing suit material. I sourced all the fabric myself in terms of high-quality bathing suit material, and we came out with the wrap. And Jeannie, who used to work at Ostomy Secrets, who's holding her sweet little daughter right there, is wearing a two-piece, and she looks fabulous. And she has that black wrap. So you can see it creates an extension of the bathing suit. And so that has been, that was really great, not only from an exposure standpoint. The bathing suits never came high enough for, by the way, for males as well as women. For both sexes it was a problem. But also you had the added security of pocket to hold it inside, so as you were swimming it was secure. And then over time I realized that I couldn't go very far from a bathroom because I was usually on the beach with my kids, and I want to stay hydrated, and I was drinking and eating. And I realized for me to go and empty my pouch, because I had to fold it in half for the swim wrap, that I would have to run to the bathroom. So running to the bathroom to empty your pouch was not the easiest feat when I had two young children at the beach. I bring them with me. So Cricket's lifestyle, she had older children that she could leave at the beach and they'd be okay, or at the pool, whereas I had to carry them all in tow. So I thought, well, wouldn't it be great if I could get a bathing suit bottom that we could fully extend the pouch the whole length instead of folding it in half? And so that's where the swim bottoms came about. So we have a men's swim trunk board short. We have the women's bathing suit skirt. We're also coming out with a bathing suit short in a few months, about 2 months, a month and a half or so. And the idea is all of our products come 3 inches higher than your average product that you buy in the store, and they all have an in pocket that holds that ostomy pouch. So you have the security, you also have the capacity when you wear one of these bottoms to extend your pouch fully, so your capacity increases in terms of, aka what that means for me is the time I have in between bathroom visits to empty my pouch. So I hope that explains a little bit about our products and how they might help you. Alan, I know that you got back into the pool, and can you maybe contribute how that worked for you?
Yeah, it worked great, and it was very crucial to me, too. So I went swimming probably about 6 or 7 weeks after my surgery, April 2013, around the time I went to work. And prior to that, during my chemo, I had nephrostomy stents and PICC lines, and so I had to wrap that stuff up before taking a shower. So I had not submerged myself in water in many, many months. And so, getting out and being able to swim was a big deal. I'm very active. I hike, yoga, backpack, things like that. And so I use these trunks that are seen here, that are shown here, black trunks, and I use that with my black wrap I referred to earlier, and it covers everything fine, like Chris mentioned. I picture frame with the pink tape. I'm a big fan of the pink tape, and I went and it was fine, and then so I went more, and it just worked out really well. It gave me more confidence to continue to get out there and do other things.
That's awesome. Ellen, I love hearing those stories because I know that you're super active, and I've known you for so long and you've always been that way. So I love, too, these testimonials of people who are out there doing their thing. If you can see the presentation, you see our good friend Karen Lewis, who in this picture, she was 54 years old. This was a year ago, and she was one of our regional Great Comebacks winners in 2011. And Karen, since her surgery, has run 28 marathons and 6 50K ultramarathons. And I love this because I'm like, man, if I think I can't do anything, I look to people like that are just out there doing their thing and not letting their ostomy manage them, but they are managing it. So on the heels of swimming, hit the pavement, run, walk, hike, like Alan was saying, do whatever it is that you do. And, I know if Karen were here and she were talking, she'd say, don't compromise your seal, because a lot of times when you are doing things, either repeated water exposure or you are sweating a lot from running, or if you live in a climate or anywhere in the summer where it's super humid, you might need to change your appliance more. Don't let that hit you up with, oh golly, I used to go 7 days, now I go 2, what's going on? Think about what you're doing in your life that might make your seal be more compromised because you're sweating a lot. So I had to put that in my mind that during the summer I may have to change more, and that's okay, and doesn't bother me with that. Staying hydrated, Lisa mentioned that. I mean, we've given tips about coconut oil and different electrolyte powders or drips or whatever that you can ingest so that you will stay hydrated. Obviously, maintaining a proper diet is really important for any kind of exercise as you're burning more calories. Lisa, you mentioned about personally sourcing a piece of fabric, and I don't know that a lot of people know that. And one thing that's really special is that we have wicking in all of our products, because we want you to get back to your lifestyle. We want you to sweat. We want you to have situations where we know there's going to be humidity, and then that wicking fabric will pull the moisture off your body, and that just really helps. And so every single piece of fabric has wicking and the right elasticity, because we want you, like I said, to be able to do what you do and what you love. And, Alan just mentioned a few things he likes to do, and he's not joking. I mean, Alan even had a stint like as a forest ranger out in Seattle, so he's really active. He is Mr. Outdoors, and I just love that about him. And I know, Alan, for you, it was a really big concern, though, when you had your surgery. I know one of the questions you said was, how am I going to maintain my activity level with this urostomy? So quickly just tell us, what's your routine and how do you manage that?
Yeah, especially with things like yoga, because anyone who's ever done, you're twisting around and doing things like that. How's this going to work? So my routine is pretty simple now. I love the boxer, I don't know if it's called boxer briefs, but the men's briefs that have the pouch. The material and the fabric is awesome. It's a wick. It's very soft. It has the pocket in it for my pouch. And that's my first layer. My second layer is the good old standard black wrap that I've referred to several times. I use it for a lot of different things. And then depending on the sport, I will also have an option of using something, it's an Ostomy Secrets product, but there are several different manufacturers out there of an ostomy guard, and it's basically a hard piece that wraps over kind of on top of your stomach, so you could actually, you could take some pressure in the stomach and it wouldn't harm the stomach. So the underwear, if I'm wearing the guard, the plastic guard, I'll wear that, and then I'll put the wrap on top of all that. And then if I am, exercising and my shirt rides up or anything, you just see the black. It looks like my underwear. You see the black strap. So it's a crucial part of kind of planning and how I prepare. And I can pretty much do everything that I did before.
That's
Awesome, Alan. Thank you so much for that that insight. I think that you are definitely more active than I am. I chase my kids around, but that's the extent of it. So you're really inspiring me to start getting out there and start exercising, especially with summer and this wonderful weather hitting us now with the springtime. So one thing, though, I will say that I learned early on is protect your core. Like I said, a lot of Ostomy Secrets is my personal experience. So I actually developed a peristomial hernia, which is a hernia right outside my stoma site. And I developed it when I was trying to get healthy and make my core stronger by doing Pilates, which then resulted in a hernia. I did not know to wear a hernia prevention support wrap. I did not know that if I had never done Pilates before, post-surgery probably wasn't the best time to start. So for me personally, I have limited activity levels I'm allowed to do. So the three things that keeps me healthy in terms of, not activating this peristomal hernia and causing problems is that I walk, I do the elliptical, and I'll swim. So those three exercises are very low intensity on your core. Also, be careful what you lift. Obviously, I didn't really have an option. I had small children, and when they were born, I had to lift them. But I really had to learn how to lift. And I was lucky enough, after I developed these issues, to come into contact with an amazing pelvic floor specialist. She was a physical therapist. And so we actually did an extensive detail about what I learned and the exercises to have in your back pocket to do after surgery to keep that core strong. Because no matter if you're male, female, whatever the surgery is, any ostomy surgery, you are going to have your core compromised because the site of the ostomy is on your abdominal wall. So I encourage all of you to go into our archives, our newsletter archives on our website, and we can send you that link later. They're in the March, April, and May issues of 2013 of last year, going into this pelvic floor and core issues. So it's something that I highly recommend reading about and educating yourself on what's right for your situation. So next slide, traveling. I mentioned summer's on our way, so we're going to work out and get healthy, and we're going to go on vacation, right? So there are some stressors with vacation. We all can think about them in terms of supplies and travel in a car and a plane and a train. And I'll share one quick story with you is that Cricket and I travel a lot over the years. And in the beginning, we were rushing for a flight, and we literally were running throughout the airport trying to get to security, and we didn't have enough time to go to the restroom to empty our pouch. So we got into the security line, and all of a sudden, Cricket got really tense, and she's like, oh, I've never been in one of those. And it was a scanner in the security that does the, I'm sure everybody knows what I'm talking about, the hands in the air, puff, puff, puff. So I had experience in going in these previously, and they tend to highlight the fact that I have an ostomy. It comes up as a hot spot. Currently now, the past couple of years, it hasn't, but when they first came out, it did. So Cricket was really stressed out because she had not emptied her bag, and she'd never had this situation before. And so any new situation, we tend to get a little bit more stressed about. So I was trying to, be calm and trying to help her as much as she's helped me over the years. So I went through the scanner, and when I got out, they pat me down, and they wiped my hands and all that stuff. And then I said to the attendant, there's another one coming up behind me. Same situation, and they just looked at me like, are you kidding me? 2 in a row, but it was really funny, and I think it alleviated some stress for Cricket in terms of, what she had to communicate to that attendant. So Cricket, I mean, you own that.
Well, it's funny because, we could all share our freaked out travel stories. We have so many of them. I've written a lot of Cricket's Corners about them. Alan, I know I'm just gonna let you take it because you traveled just even last week, and you told me, you're like, oh my gosh, everything. Let me share. I have to tell everybody what happened to me. So go ahead.
like we were talking about earlier, preparation is absolutely key. I get a big gallon Ziploc bag. I put all my pre-cut wafers in there. I pre-cut them myself, put extra supplies. And so that is with me on my backpack and is always, I don't check my bags. It's under my seat. I think another thing, too, is to make sure and leave my scissors at home. I know, like I said, I pre-cut my bags, so I involve scissors, so I keep those at home. And, yeah, I was in the Burlington, Vermont airport about a week and a half ago, and I went through the puffer, and just like Lisa recounted, mine showed up, and I had forgotten my ostomy, my TSA ostomy card. I used to have those. It wasn't that big a deal. I was a little nervous, of course, and I asked the guy, I said, I have an ostomy. Do you know what that is? And he said that he did. He said they would need to take me to a private area, and they did, and I didn't have to drip down or anything. I barely had to lift my shirt up. Again, just like Lisa said, they wanted me to tuck it in, and they ran some chemicals on my hand, and it was fine. And even with that, going back and going back into the terminal, I was a little nervous. I had to sit down and kind of, regroup a little bit. I think it was for me, it was very important to honor that. Okay, yeah, everything was fine. I got through it, and it can be a little nerve-wracking still.
Absolutely.
Thank you so much, Alan. I think that that's such a great story. We've had all those moments, especially for those of us who travel a little more than others. So, the other thing I'd like to add is wear comfortable clothing. And, if you're going to be in a car for a while, I was just on a 20-hour road trip recently, and, I wear comfortable clothing so that I have time to be able to empty. Not always will I have, let's pull off the side of the road, we got to go. Sometimes you have to wait a little bit, just like on an airplane or a train. So, just kind of prepare like we've mentioned. So go out and travel and enjoy that life. And some final thoughts in terms of what we hope that you've gathered today. In the first webinar, we addressed a lot of the border piece of this puzzle, so things that, diet, appliance maintenance, just a lot of basics that are really important, a lot of tips in managing just everyday, like minimal stuff. And so today, we hope that we made a lot of your inner pieces a little maybe more firm in your puzzle, and we discussed some tough topics that now you are ready to go ahead and tackle. I hope that Cricket and I and our team provided you with insight today that will help you live a better life after ostomy surgery. We hope you continue to reach out to us in the future. Remember, you could always call an Ostomy Secret specialist. We are always available to you. And I really, truly want to thank you for your time today. I know that everyone has busy schedules, and this has been a little over 45 minutes of us talking. So I really appreciate the love and the support that we get from our current customers and in general people who reach out to us. We are who we are today because of you.
Agreed. And, just to follow up on that, your time is precious. We really appreciate that. And we do want to provide information for you. So, as Lisa said, there's peer-to-peer support at Ostomy Secrets. Everyone that works for us has a permanent ostomy, and that's just really, that's gold right there because they know what you're walking through. The Inspire Ostomy Support Group at ostomy.inspire.com is a great source where there's over 6,500 members, and everyone can just really build each other up. The UOAA national organization with local support groups are great to get plugged in your area, like Alan was saying that he goes to one in his area, and that's just so important. And then, of course, the Convatec manufacturer hotline where you can actually speak with the WOCN, a wound and ostomy incontinence nurse, to get information if you are not having a good seal or you need some supplies and you'd like a sample to try before you buy. That's a great thing to do, or you just have a question. So we do really want to thank you. And as a thank you, we want to offer you a special order. If you order anything off of our website, ostomysecrets.com, by May 19th, we'd love to give you 30% off your entire order. The code is OSWEB, W-E-B, number 2 at checkout. You put that code in at the checkout. And then also today only, we've got an excellent skincare line of a sting-free releaser spray as well as remover wipes, and that's limited to those who attended the webinar. You can email Heather at ostomysecrets.com to redeem the free products for the skincare as well as your 30% offer. So we thank you. I want to thank Alan so much for joining us. It's great to have your insight on this. Allison, I'm going to throw it back to you and thank you. And then after you say your goodbye, I'll throw that slide back up about the offer and the special code.
Excellent. Thank you so much, Lisa Cricket, for another great presentation. And thanks to all of our attendees out there today. We've recorded this webinar and we'll make it available to you soon. And as Lisa and Cricket mentioned, please watch your inbox for the invitation to the next webinar series from Ostomy Secrets and Inspire. So let's get that code back up and everybody have a great afternoon.
You are now unmuted.
You are now unmuted. You are now unmuted. You are now unmuted.
You are now muted.